Hi, this is SNF Wound Care. I'm doing rounds today. Come follow me and see what we do. All right, so we have here a patient who had a recent hip replacement within this past month. They are here for orthopedic aftercare and physical therapy, and they're asking us to look at the wound and make sure it's healing nicely post-surgery. Only issue she has is she has pain locally, and we're gonna make sure that she has no underlying wound infection. So the wound's all healed up. The scar, there's just scar tissue, a little piece of scab there that doesn't need local wound care. We're gonna leave it alone, wait for it to heal on its own. If the patient has underlying issues with pain, I have her follow up with her orthopedic surgeon. So next we have a patient with a history of vascular disease, had a recent amputation due to vascular disease. Issue with her wound is she's been developing something we call eschar on top of the wound, which are really deep and firm scars. Usually I like to dress it with a medication called Santal to help soften that eschar off and be ready for me to take off. And she's ready for me to clean her up today. Cleaning the eschar off the wound helps definitely heal up the wound and expedite wound development and wound healing. So after assessing the wound, the patient has a lot of dead tissue and the tissue is extending all the way to her bone. Cleaning her at this point to the bone is poses a concern because she's on a blood thinner called Eliquis. If I clean too aggressively, she will bleed, and the wound will need to be addressed as far as surgically outside in the hospital. So I'm recommending that she follow up with her vascular surgeon. He needs to assess the wound, clean it in the OR nicely down to the bone, and at that point decide whether or not he's going to extend the amputation up to get good coverage on the bone, or clean it down to the bone and send her back with a wound vac, which suctions down the wound and suctions the wound onto the bone and hopefully heals that way. I can't make that decision right now. She would have to go to the operating room to see how deep the wound has to be cleaned, but doing it at bedside right now is dangerous due to her risk of bleeding.